At the KSML studio, it's time for our spotlight on the Salem Memorial District Hospital. Dr. Tiffany Bland is with us. It's been, I guess, since January, the last time
It's
we
been quite a
actually
while. I didn't
did our
remember when the
interview.
last
Yeah,
one
well, you
was.
came in and you were still fresh, brand new.
Yeah. Now I've been there for almost a year.
Oh my gosh, isn't that crazy how fast
It's flown
time
by.
flies? So, baby, doing good?
He's doing great. Getting big.
Mm-hmm.
Doing all of the things.
That a baby's
Into
supposed to do.
everything. Yes.
Yeah, well, that's good. That's great.
Very active.
Very good. That keeps Mama active too,
It
doesn't
does.
it? Yeah, that's very good. All right. Well, we're not. Well, we could sit here and talk about the kids. That'd be fine too. But we are here to talk about SMDH family medicine, and the clinic is growing, getting bigger. Got a lot of the phone issues resolved, so that's made it a little bit easier, hasn't it?
Yeah. The phone issues have definitely. It's been a struggle recently, but now we have lots of new people who are learning the system and answering phones. I've already gotten a few patients telling me that they're having an easier time getting through, so that's really reassuring. We still have a lot of progress to make, but
Oh yeah.
we're headed in the right direction for sure.
Gonna be adding another couple of windows too in there.
We
to help
are.
out. So
yeah,
that's-
they already have
that's-
the windows created. We
Yeah.
just have to, I think they have a few final touches and getting the people.
There you go. So it won't be too long a line to wait inside
Yeah,
to get.
that'll definitely help. You'll be able to do things on either side now.
Right. Very good. Very good. Well, anyway, that's we're not here just to talk about construction either. I mean, that's great and improvement, but we are here to talk about the clinic and different things going on there, and we're seeing more and more nurse practitioners and doctors coming on staff. Dr. Neely just got started September 1st.
Yep.
Got two more coming in here very shortly, and before I think it was November 15th, they'll both be on board. I believe that's the.
I'm not sure about Amber, but I know Samantha will be starting
Yeah,
soon.
I think she'll be
so-
on by October, I think is what I
Yeah,
heard with
so-
her. The other one I think is going to be, I think, here mid-November.
You may have heard before I did. So.
Well, they said at the board meeting.
Yeah.
You know, so I'm trying to remember off the top of my head.
Yeah.
But with all the new practitioner stuff, there still are specialized medicine that still needs to be discussed, and you're a full-fledged doctor.
Yeah, so my specialty is family medicine.
Mm-hmm.
You know, one question that's come up recently is the difference between family medicine and internal medicine. So I did just want to clear that up. Family medicine does see all ages. Internal
Mm-hmm.
medicine tends to focus on adults. For family medicine training, there's more of a focus on the outpatient side of things. You know, we do see people in the hospital and
Sure.
we do OB, but there's a focus on the outpatient setting versus internal medicine. There's more of a focus on the inpatient side of things. But, you know, those are really the main differences. Otherwise, we're both primary care. We see a lot of the same issues, and we feel comfortable treating a lot of the same things. You know, there's a wide spectrum of things that you'll see in the outpatient setting, and we both, you know, are equipped to handle all of those. The other focus is that family medicine does see a lot more women's health, you know, along with the children. So I am able to do a lot of that and provide a lot of those services that maybe necessarily weren't provided before or referred to gynecology in the past if you were seeing an internal medicine doctor.
Okay, so but one of the neat things is that now with the additional staff, family medicine means family medicine. That
Yeah,
means your
from birth to
children,
death.
all the way through, and
The
we're
whole
getting a lot
family.
more younger doctors in, and then so
Yeah.
it's going to be a continuing force for your family from now on.
Yeah. I think we're seeing a lot of exciting changes. We're going to have so many new people. So I think there's a lot of experience that some of the older physicians bring. So we have some of that, but we also have a lot of new providers that bring in all the latest recommendations too. And I think when we communicate with each other and we tell each other what we know, then we can really just cover it from all aspects. So
And when you have as much experience, just like you talked about with Dr. Neely, Dr. Al, you got different people, Dr. Bruno, they've all been around a long time. You know, a little conversation saying, you know, I've got this patient and they're talking about this. Have you experienced this before? Well, you find out how many times the doctor might sit there and say, oh, yeah, I remember that case. You know, and I'm sure it happens because there are some strange cases out there.
Yeah.
Obviously, we're not going to talk about one individual case or anything, but there are some things out there that sometimes you just scratch your head. You say, I swear I thought it was this. But, you know, by listening to other doctors and hearing what they say, everybody learns, don't they?
Yeah, no, I think it's so important to you collaborate with the other providers in the office. I think that's always an important relationship to have because they're going to have experiences that you haven't had. And I think vice versa, I'm able to offer some advice as far as the newer guidelines. So I really appreciate having those other providers there to use as a sounding board at times. So
Nice to have that old experience.
yeah.
Well, because things have changed, like you're
Not
saying.
old.
But it is old. I mean,
Experienced.
But when you get somebody who's been doing it 40 years,
Yeah,
I mean, just think how much changed in the medical field in 40 years, from when they started to where
Yeah,
they
and
are
sometimes
now.
learning the history on things that didn't necessarily come up in class is fun too for me. So.
How things evolved, because that's really important. When we talk about family medicine, you were talking about from life to birth all the way to death. When people have an issue with their children or have an issue with their own health, don't play around with it. We were talking the other day. I talked to Dr. Al, but I was also talking to actually mom, and she goes, look, everybody thinks that they're their own doctor. They go on WebMD and they start looking at things and they say, well, yeah, that sounds like what I have. Well, no, so that sounds like what I have. And that sounds like what I have. So all of a sudden you got 52 diseases and you think you can treat yourself.
Yeah.
And a lot of times it may not be much of anything. You can walk away and not really have a problem. But other times you want to get a diagnosis as quickly as possible because there may be something there.
Yeah, well, and anytime that you're not sure, it's always good to see a provider. We're trained to know what questions to ask, and we know what answers are red flags and what really needs to be worked up further and what we can just monitor. We don't expect other people to know that. It took years of training for us to figure that out.
Sure.
So.
And when you talk about family, a lot of things are genetic. So if you see mom and dad, then you see the kids. A lot of times what you're treating mom and dad for, those children may end up having the same thing later on in life.
Oh, yeah. It's really fun to treat a whole family because you already know their family history really well and you know what things are running in the family, maybe what medicines somebody responded to well is what that patient's going to respond to as well. So it does help to know the whole family.
And when especially youngins get in there, it's a little bit different because they're bouncing all over the place. They don't want to sit still. And parents have to, kind of try and keep them down. I remember as a young, and I used to pick up everything that was in the doctor's office.
Yeah.
And what is this? What is this? Tongue depressors and everything else. Gosh, what do I do with this? But the neat thing about the kids they're inquisitive. They want to know. And I know doctors can't really talk to a child about the diagnosis that they're going to understand, but it really is a unique way of conversing. Now that you have your own child, you find that same way too, I'm sure, is to communicate with those young people to get them to understand, hey, we have to do this, and it might hurt a little bit or something.
Yeah.
You treat that child a whole lot different than you might treat an adult, right?
Yeah, so I think in the past there's always been people who said, oh, they're just little adults. And it's like, no, they're a whole different ball game. They have their own set of diseases, a whole different way of approaching it. They don't tell us what's going on with them the same way that an adult does. They can't explain pain sometimes the same way, depending on their age. So it is a unique challenge, but it's one that we've been trained to deal with. And we do have our ways of getting the information from the kids and the parents that we need. But as far as them being active in the office, that's definitely not anything that's new to me. I have a very active little boy who thinks he needs to be into everything. So that is never going to bother me.
Until you look for something that's not there, right?
Our cabinets are supposed to be locked in the bottom. So, all that child proofing is supposed to happen anyway.
But this is the development stage for that child where you start talking about a birth to death, possible relationship with a clinic and doctor and things of that nature. This is the time, though, when you develop that relationship with that young patient to where they trust you, and when they come to the doctor, they're not worried about anything. They know you're going to shoot them straight and tell them what it is, or that you're always going to be welcoming to them and concerned about their health, and they're not going to have to worry about that.
Yeah, I think I'm kind of in a fun stage where I'm still meeting all my patients and we're still developing that relationship. But really the goal for most family medicine doctors is to grow with their patients, and you just really can have long relationships because of the specialty, which is really unique and and a wonderful part of the
Right.
specialty.
And trust is a huge part of that.
Yeah, when you've been with the same provider for years and years, which is my goal eventually to get there, you really build that trust. So.
Because then if you have a question or feel something wrong, you don't hesitate. You just kind of call and say, hey, can I make an appointment? I'm not feeling right, or this is wrong. Because sometimes, and I know from my own family, from my own sister, she would never call a doctor, even when something is wrong. Well, I don't want to hear what they're going to tell me. Yeah.
But it could be something small or something that if we treat early, it's no big deal.
Exactly.
You just never know until you talk to the provider.
But until you take the first step and contact the provider, you're not going to know. And it could be
I think that is something that I run into often, is that people are afraid of the diagnosis, and so that prevents them from seeking help. But it's not always the scary thing that we looked up on, WebMD. Sometimes it's something very simple, and we could really just provide you some reassurance.
Right.
Or,
It's probably not that tropical disease from one location that's been found 3 times in the world. I've got it.
you just never know what you're going to find when you Google, but
No.
that's what we're here to help with.
But that is a misconception today anymore, that I can go find what I want. Hey, there's a lot of good stuff on WebMD. Don't get me wrong. There really is a lot of neat things, and you can find out symptoms and different things of that nature, right? But don't think you can do self-diagnosis off WebMD. It just doesn't work.
Yeah. There's just so much more to it. And, like I said, we don't expect you to have that information that you need to differentiate between disease processes. So.
And also, when you need to get labs done and things of that nature, it's kind of hard to do that off WebMD.
Oh, yes. Sometimes there's some additional workup that needs to be done before we have an answer. I often tell my patients that we're not always looking to rule in a disease, but sometimes we're ruling out other things first.
Exactly.
And so when you explain that process, I think they're understanding. But, yeah, you can't do that off of WebMD. So.
And I would like to explain, and you being the doctor, and I'm not the doctor, you are, and when you do talk with people, you want to put them at ease about everything with their situation, and that's good. That's what doctors do the best, I think, because they really are seeing people at their most vulnerable time.
Yeah.
Because they really are in an unknown state. They walk in, I don't know what's wrong with me, And so when I see doctors, they befriend their patients a lot, because getting that trust in your doctor and believing what they say, and then following the protocol that you suggest to get them maybe past whatever they've got, they really have to believe in you, and they have to believe that what you're giving them is the right thing. Because the last thing you want to say is somebody gets started on a treatment and say, you know what, I don't think this is right for me. Now, if they have an issue with drug medication or some kind of reaction, yes, you want them to get in touch with you. But let's try this, because I think this is going to take care of you, and you'll be feeling great in a little, very, very soon. You've got to have that trust.
Yeah, and I think doctors have kind of been put in a tricky situation where insurance wants us to see more and more patients. There's a push to be faster and see more. But, it's always been my goal to actually sit down, get to know the patient. I tend to ask a lot of questions so that we can get the right diagnosis or order the right tests. But yeah, you got to find that balance between making sure that you don't have patients that are waiting hours to be seen, and making sure that you ask all the questions, build that relationship with the patient. And I think it's so, so important to counsel them, not only about what you think is happening, but about what tests you're ordering, what medicines you're prescribing, all the possible side effects, next steps. And I think if you're missing that, it's going to be really hard for the patient to trust you, because they're just blindly taking these medicines. And so when they have a side effect, that's not going to bode well for you. So.
And especially if they expect immediate results, as well as
and
I
that's
do.
That's a big part, is reviewing expectations.
Yeah, because say, guys, I remember my father had to get put on antibiotic for C. diff, and it's a long process. It's like 3 weeks, and they said you're going to do this, 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 and this, and you're going to take a lot of these antibiotics up front. And my dad, what's it going to do to me? And they told him, And he said, okay. But he says, but you have to follow it. And then we're telling you, you got to take 5 of these this first day and take them every 3 hours. And, please make sure you get as close to that as possible, because we're trying to treat this and knock it out now so it doesn't come back. And, like you say, I think when the doctor explains to the patient what the purpose is, why you're taking that drug, that whole belief I think we're going to knock this out. They believe it themselves, and that's a big part of the healing, isn't it?
It is. I mean, we've had multiple studies that show that there's, we have the placebo effect, which is that we tell you this pill's going to work, you take the pill, it works. Doesn't always work that way, but it's a big part of your healing process is, hope and feeling like you're going to get better.
Absolutely. Very good. Anything else you want to talk about today?
No, I would just say that there are a lot of changes coming to the SMDH clinic. I think that we're going to see a lot of good. It's going to take some time. We appreciate our patients for being so patient with us as we've gone through so many of these different transitions. But hopefully we're already seeing some improvements as far as the phones getting answered and getting a response quicker. So
getting the physical parts of the hospital changed out is one thing, and then of course the access, as you mentioned, it'll be a whole bunch different now inside.
Yes.
And I think what people remember, like half and half, kind of weird, all within one medical clinic. But that's all being corrected, and then people will be able to go in there and have a number of different practitioners to choose from.
Yeah, they'll have lots of options
Yeah.
moving forward.
And if somebody's not there, and especially I know that they've talked about expanding the care to the weekends, possibly somewhere down the road. I mean, that's not tomorrow.
That has been discussed. I haven't heard any final plans, but
No,
we
I
would
haven't either.
love to have somewhere for our patients to go on the weekends,
That would be great.
other than
Fantastic.
the ER.
Yeah. Well, it'd make it a lot easier.
Yeah.
And it saves people a few dollars here and there. But
Yeah.
and then I always think when I think of the ERs, I always think when it's called an emergency department for a reason. There's an emergency.
Yeah.
I mean, I went and I sliced my fingernail and kind of with a scoring knife cutting tape, and you see people turn white in the face because they see blood kind of gushing for a second. I said, that's only the pressure of the fingernail. Look, I'll get it taped up. I'll be good. And they said, don't you want to go to the emergency room? I said, no, that is not an emergency. Now, if I cut my finger off or had half of it cliced, or I cut a vein, or that's an emergency.
Yeah, and I think everybody's definition of an emergency is different.
Right.
So I encourage my patients, if you don't know if it's an emergency and it's during office hours, obviously you can always call me and we can help you to triage it over the phone.
Sure.
Sometimes you just know, that you need to go in, but other times it can be kind of on the line. We see anybody that we can in the clinic, but when we just really feel like it's an emergency, we're going to let you know and we're going to set you in the right direction. But you do want to utilize the emergency room for emergencies the best that we can. In a rural area, we are a little limited because after hours there aren't a lot of places to go. But
This is exactly true. Especially breathing difficulties,
Yes.
chest pains, things of that nature, right to the emergency room.
Yep.
Get there as quickly as possible. Anything where dizziness, strokes, you may start slurring your speech. You want to get there just as quickly
signs
as
of
possible.
stroke.
We want to be able to do that. Salem's got a very good STEMI program. It's one of the best. When you talk about small rural hospitals, you're not going to get much better than what you get here, and they can diagnose you and get you out very, very quickly if you need to move on. Wonderful. Good to have you here. And if
Yeah,
somebody
thanks
would
for having
like to discuss with you becoming one of your patients, how can they do that?
All they have to do is call the clinic. Like I said, we have multiple people answering the phones now. Some of them are new and they're still learning, but if they don't have the information, they know where to find it and they'll get that information.
729-8000.
But yeah, all you have to do is call and request Dr. Tiffany Bland. There are 2 Blands in the clinic now, so there's been some confusion. Michelle Bland, Shelley Bland, she's our nurse practitioner. She is my mother. But I'm Tiffany Bland, and I'm an MD, so.
Very good. So if you would like to, just call 729-8000. You don't work Mondays.
I do not work Mondays.
Okay, so that's your day off.
Tuesday
so-
through Friday.
So she's off on Mondays, Tuesday through Friday. She's more than happy to accept new patients.
I am.
And you usually see them, is it Friday mornings? If you try to schedule that first one where you take a little more time to kind of...
No, they really just work
just
with
wherever
you,
they
whatever
fit in?
your schedule works. So the nice thing is that we are there 8 to 6, so 6 does, stay in later. That helps for some of the people who work. We try to work around that, so.
So if you need a family practitioner, SMDH Family Clinic, right there on the campus in Physician Office Building number 3. Again, that number 729-8000. Dr. Tiffany Bland, our guest today on our Spotlight on SMDH. good to see you again. Don't wait half a year to come by and say hi.
Yeah, I'll have to talk to them about that.
Okay, thank you very much,
right,
Doctor.
thank you.
We appreciate it. Keep it here. KSMO Civic Happenings next.